Well, good afternoon. My name is Michelle Hill. I'm Community Outreach Supervisor for Greater Nevada Credit Union. Thank you for joining us on this recorded presentation. We would like you to put yourselves on mute until the question and answer sections. You can either choose to chat with us, or you can take yourself off mute and ask the questions of our presenter. Greater Nevada is finding a growing need for financial education from our community members. Each month, we will be showcasing a financial topic that we hope will help our community move forward towards financial wellness. If you're interested in learning more about these webinars, please check out our website at gncu.org and search for Greater Financial Wellness Hub. Today's presentation is on Medicare 101. I would like to introduce your presenter, Robb Anglesey. Robb is an independent insurance and financial advisor working out of Northern Nevada. He has been in the insurance and financial services business since 2012 and is an advisor for Greater Nevada Financial Services since 2018. He specializes in Medicare insurance sales and education, as well as retirement, health, and financial planning. Robb and his wife, they have 2 sons and 1 daughter, and enjoy spending the time outdoors. He loves playing, watching sports, and barbecuing. Welcome, Robb.
Thank you, Michelle. Hey, I want to say it's a great opportunity. This is one of the first webinars I've done, and I hope to do a lot. So thank you, Michelle, Saray, and Stephanie, for putting this together and making it so easy for me to get this information out there. So like Michelle said, I'm an independent agent. I've been in the Medicare space for a while. I've been in the financial service arena since 2012. So I've learned a lot over the time doing this, and this same presentation is what I give to each individual that I meet with. And so I'm very well versed in this presentation. Look forward to doing more presentations to get more in depth on Medicare. And if there's more demand, let us know. Also, let us know if you have friends or family that could benefit from this and get on our emailing list for in future webinars. So today we're going to talk about Medicare 101, and this presentation will just touch on the basics, and I'll break on certain slides after certain slides, and we'll have questions. And what you'll find is a lot of the questions that you have will be answered in subsequent slides. And so just write your questions down, and then maybe at a break, if you didn't hear your question, we can get those out there. So let's begin. So let's see here. Got to click on my screen. There we go. All right, so Medicare, it's an interesting program that the government gives us. So we've been paying taxes into Medicare almost our whole careers. For those turning 65, it's quite a long time we've been paying into this program. So we want to figure out what sort of benefits the program provides. First, I will direct your attention to this slide. So we will talk about
10th, I think.
We'll talk about Medicare as a whole. You'll get a card in the mail when you turn 65. When you enroll, it will look like this. So here's John Smith. He has a Medicare number that's unique to him. There's Hospital Part A, Hospital Part B, and then coverage start dates on the Medicare program. One of the common questions that I get, the most common question, is what if I'm working and have a work plan that I'm associated with at work? And do I need to enroll in Medicare? The answer to that is no, you don't. You do not need to do anything. So there's a misconception that you'll have to enroll in something or whatever, but the real answer is you don't have to do anything. You can stay on your work plan, and the government allows you to keep that plan if you want. Now, I will say that it's to your advantage to get with somebody like me who understands work plans and Medicare plans, because we can explain to you the differences in both and whether one is better than the other, and what a normal, what your situation, what the costs associated are with each one, either a work plan or a Medicare plan. So, yeah, the answer is you don't have to do anything if you want to stay on your work plan, but Medicare is available to you, and it's a good opportunity to figure it out when you turn 65. So for those turning 65, also for those who are disabled and get disability, Social Security, get eligible for Medicare as well. And so in 65 or disability, you have the opportunity to get on Medicare. So let's talk about the parts of Medicare. So very simply, Part A, I like to think of Part A as hospitals. You got inpatient hospital, you got skilled nursing facilities or rehab centers, home health care, hospice. This is all encompassed in Part A. You'll see the monthly premium on this slide says typically it's $0, and I'll go into details on that. So $0, you've been paying your taxes. This is what the government will give you for that. So I'll go to the next slide. The bare bones benefit for Part A includes a deductible. So it's not all free. Sometimes people are like, oh, that's a lot of money to pay. So the government will provide some coverage. So this is what you owe when you go into the hospital. Let's say you break your hip and you have to go in and you spend a couple days in the hospital. You owe a deductible of $1,556, and that's per benefit period, up to 5 times a year. So each event that you have in the hospital, that's what you owe. Now I'll explain later about how to supplement these costs, but this is just the bare bones Medicare, okay, for Part A. If you go beyond 60 days, you can see the schedule here. You have co-pays per day you're in the hospital. They can reach up to, you see numbers down there, up to 46,000, 15,000 on these. Knock on wood that we never spend 60 plus days in the hospital, but that's the schedule for Part A. Medicare Part B is for doctors. So we have office visits, we have ER, we have surgeons, outpatient doctors that go into hospitals. That's covered in Part B. It's a good distinction to remember. Lab work and ambulance and things like that. Monthly premium for that, see on the bottom, is $170.10 for this year. It's gone up from $155 or $145, I forget, but it goes up periodically. The cost of living goes up, your Social Security goes up, your Medicare premium will go up over time. So this year it's $170.10, typically. So I will go into why it wouldn't be $170.10, and that would be if you make more money. So here's a tax bracket that will indicate what you would owe in Part B premium if you get on Medicare. So here's the schedule for income in 2020. So it's 2022. You got to look back at 2020 on your tax return. If you're filing jointly, if you made less than 182, then you owe that 170.10. If you are single, you make less than 91,000, then you still owe that 170.10. And so as you go up and as you make more money, you will owe more according to this chart. So that's just that's what we got to be aware of. 90% of people I meet with are under that. So you owe the 170.10. Okay, continuing on. So the Part
Hi, Rob.
Yes.
Sorry if I could interrupt. We just had a question, and I'm so glad we're still continuing on Part B, but I figured it would be great to bring up now. Do you have to have a Part B?
No, you can enroll in Part A and not have Part B. Okay. But typically the people who do that are on work plans, and so they are already covered. And so yeah, you can go through the process of enrolling in Part A only if you want. Here's another distinction. If you're drawing Social Security and then you turn 65, they will assume you want A and B. And so that's something to be aware of, because they assume that you are taking retirement money, that you are retired, that you will need coverage. And so if you don't want coverage, you'll have to arrange with the Medicare office, the Social Security office, to get that taken off if it automatically happens. But for most people who aren't, who are not taking Social Security, you will have to enroll yourself if you want to get on Medicare's A and B. So good question. You can get A because it's a zero premium, right? You can get that. You can enroll in just A if you want. I will continue. So on the break, we can get more questions. That's a great question. Hopefully I answered all that. If there's follow-up, let me know. So Part B is, so the deductible for Part A, we know that $1,500 was a deductible for A for going into the hospital. You got to pay that. B, it's lower. We're paying a premium, but it's lower. It's $233 a year. And so once you reach the deductible, then it's 20% of services after that. So you're in that hospital, you have a surgery, you have a surgeon come in, and his bill is $20,000. You'll pay $233, and then the remaining, you owe 20% of that. So that's how Just B alone works. Again, I'll talk about supplements that kind of fill these gaps here. So we'll go into that. Just interesting to note, some people ask, well, you know, how prevalent is Medicare? Am I going to get everything covered? Basically, there's a lot of claims submitted to Medicare. You can see in 2015, over 1 billion claims submitted. 99.5% were accepted by Medicare. So a lot of procedures out there, most of the procedures out there will get covered by Medicare. You got to make sure that you're not, if you do something experimental, for example, or if you do something that isn't approved by Medicare, then you may not get coverage. So that's one of your duties as a Medicare enrollee, is to make sure that the services that are being provided do take Medicare. And most of them are. I mean, like this says, 99.5% have been accepted by Medicare. So that's Part B insurance. So any questions on A and B coverage? And if there's questions that will be covered, I'll let you know. But let's take a break here. Let's see if we have any questions.
Awesome. Thank you, Rob. This was a perfect spot. And thank you for answering that question on Part B earlier. I didn't mean to interrupt, but I definitely didn't want to pass it up. The next question, it's a great one. So for working persons, is the premium deducted from Social Security payments?
So if you're working, so if I understand the question correctly, if you're working and you're taking Social Security and you're getting on Medicare, then here's the short answer. If you're taking Social Security, yes, you can get that deducted from Social Security. So that $170 a month, that's actually what I recommend, is that you deduct that from Social Security. That way you don't have to worry about bank accounts and, you know, missing premium payments. They'll just deduct that off of your Social Security. So that's a good question. That's the answer. So you're taking Social Security, yes, you will deduct the premium for Part B off of Social Security.
Thank you, Rob. I hope that answered your question. If you have any further questions, we welcome you during this presentation to type them into chat. We will have a few question breaks, or if it's on the topic, I will absolutely interrupt Rob and make sure we get that answered for you. But it looks like that's all our questions for now, Rob, so I think we can continue.
Perfect. So now let's talk about supplements. So a lot of people have questions about this. We know we owe $1,500 to enter the hospital. I mean, you go into the hospital and you spend a night, that chances are you're going to reach that, right? So we go into the hospital, we had that to pay. We have the 20% to pay for Part B, right? And you'll see on these Medicare supplement plans, just think of these plans as like a second payer. So you have your Medicare plan A and B that's provided by the government will pay up to a certain point, but then there's gaps to fill, and you'll see that this is called a Medigap plan. So there's gaps to fill. So you'll see on the benefits, Part A, coinsurance and hospital, Part B, coinsurance or copayment, blood work, the hospice care, skilled nursing care, the Part A deductible. So, right, most of these plans will cover that $1,500 deductible that when you enter the hospital. Part B deductible may be covered. I'm going to skip down. This is a schedule for plans before 2020. So I'm going to skip down to after 2020. And I'll direct your attention to Plan G in the middle, that star, Plan G. On a supplement, if you have Plan G, you basically get everything A and B covered except for the Part B deductible. And so that $233 a year for Part B. And so if you're on something like a Plan G, it's great because you get pretty comprehensive, almost full comprehensive coverage for your A and B benefits. And what happens is you go to the hospital, you give them your Medicare card, and then they produce a bill that Medicare doesn't cover. Instead of giving that bill to you, they'll send it to a private insurance company that holds your Medigap plan. So for example, United Healthcare, Aetna, Humana, others. And so these private insurance companies can come in and fill the gaps for you if you desire. And so I'm going to continue on here. We'll talk more about supplements and more about alternatives to supplements as well. And so we'll move on. Part D is for prescription drugs. So this is a separate schedule from A and B altogether, but this is going to lower your drug costs, help against higher costs. And it's good to understand this, and it may be more important to people with brand name drugs and things like that. But in my opinion, it's good to have that everybody explores getting Part D, because there are penalties attached if you do not enroll right away. And so how that works is if you turn 65 and you get on Medicare's A and B and not D, and then time lapses, you eventually want coverage because inevitably we have needs later on in life for prescription drugs. You get on a Part D plan, you may pay more than you would normally on the Part D plan because of this penalty feature that's there. I can go more in depth in that if that wasn't clear, but basically my recommendation is you can get a Part D plan for for not very much money, so $10, let's just say. So it's good to explore that and get some coverage, even if you don't have prescription drugs or just have minimal prescription drug costs. So I'll go more in depth with that at another time. But yeah, we'll just go on from here. And so this is the schedule as well. So when you make more money, you will add money to your premium according to this table in your income status. So this slide explains a little bit about Part D and a feature called the coverage gap, which isn't much of a feature, but it's just a way for them to curb costs because prescription drugs are expensive. So if you're on a Part D plan and you and your plan spend $4,430, you go into what's called the coverage gap. And so in this scenario, you may pay a little bit more for your prescription drugs on Part D for a period of time. And then there's a second phase after you've been in there and I think the number is 8,000 and change. After you spend that amount of money, then you actually reduce your costs. So they give you a break there. So there's a little understanding in Part D. Basically, if you just have generic drugs that are less expensive, then you won't have to worry about this coverage gap most likely. For those people on insulin or have high cost brand name drugs, things like that, this is something to be aware of. And I can help walk you through and actually give you an idea of what coverage would be like on Medicare as far as prescription drug coverage. So that involves a one-on-one consultation. Okay, so there's a second way to get supplement coverage, and that's Medicare Advantage. So you have an avalanche of mail when you turn 65 coming out of your mailbox, and it's all talking about Medicare Advantage and things like that. And so what that involves is basically, instead of having a two-payer system where you have Medicare and then a second insurance company pay for your A and B coverage, it kind of encompasses it all in one. So you have one plan and one card. And what happens is the government has some money set aside for you for your healthcare in the Medicare program. These Medicare Advantage plans are provided by private insurance companies, and they'll take that pot of money that's reserved for you and give it to them. And what that enables them to do is actually do what they do best, and that's manage care. And so they're able to give you more benefits than just the bare bones A and B coverage, but do it more efficiently because they have contracts with networks and things like that. And so we'll go into a little bit of detail on these plans and how they work, and whether or not we have the supplement plan or the Medicare Advantage plan. But just remember, Medicare Advantage is one plan, one card. It's the package deal. Some things to be aware of with Medicare Advantage is they may have deductibles. A lot of them don't. They have extra benefits. We'll go over those in a little bit that A and B just doesn't provide at all. There are co-pays. So the co-pays with Medicare Advantage are different from the supplement coverage because the supplement will just pay everything. So you may get nickel and dime with co-pays on Medicare Advantage. There are yearly out-of-pocket limits, and you gotta navigate networks on these plans. So that's a little different. The premium, there may be premiums, and there may not be premiums. So there are things like that provided by Medicare Advantage. Here is a slide. I kind of get a kick out of this slide. Many seniors here enjoying their coverage a lot. So we got eyewear coverage. We got gym memberships. So that's included in a lot of these Advantage plans. The hearing aid benefit. My dad wishes he was on Medicare for this hearing aid benefit. He just got some a couple of years ago. Prescription drug coverage, we talked about that. Dental care, this guy cracks me up a little bit. He's way enthusiastic about his dental care, and I'm not that way at all, but I aspire to be like him. So he gets dental coverage with Medicare Advantage plan, which you don't get with A and B at all. And then there's other little tidbits that they might do, like telehealth. I really am a proponent of that. If you don't want to go into an urgent care, you don't have to. You can do online or web conferencing or telephone, or there's different ways to get care, and these programs kind of help you navigate that. So,
hello. Hey.
So yes. So this is a great slide to reference here. So this is going to give first of all, you have to decide whether you're getting on Medicare or not. If you're on a work plan, you have to decide, does my work plan work for me? Is Medicare better? Should I hop on Medicare now or wait for my work plan? Or be on my work plan going forward. Then once you decide to get on Medicare, you have to decide what plan, what route you want to go down. So on the left is the original Medicare plan. That's what I like to call it. You get A and B, you get a Medigap policy, and then you get a separate Part D policy. And you go out and find those. You find people like me, a licensed agent in your state, and help you identify these. Consider this route like a la carte. You're going out and you're purchasing these things separate. On the right is the Medicare Advantage plan. They will include Part D. A lot of them, some of them don't, but most of them do. So they're the package deal. You got A, B, and D, and then they also include those extra benefits like dental, vision, and hearing. So this is the two routes that we got to decide here. Okay, so let's break for questions. Maybe we have quite a few, and then we can answer
We
those.
do. Thank you, Rob. I'm so glad this was perfect timing. We've had a few come in. And I will just start at the top. I love this question. For a veteran who uses VA services for 100% of their needs, is Medicare needed?
Yeah, good question. So you can use your VA benefit exclusively if you desire, if you want. I just met with a VA user. He exclusively uses the VA, but he was interested in the dental, vision, and hearing coverage. And there are plans that don't provide Part D coverage, but provide hospital coverage and B coverage, which he usually uses the VA. But he expressed the concern that, if you're incapacitated and they take you to the hospital, that's just kind of the deal, right? If you get, he lived in Douglas County, so it's a long jaunt to the VA. So that was his concern. And we were able to find a plan that could, that was a zero premium plan, for example, that he could still get Part D coverage, get the prescription drugs from the VA, but he has the option to use medical elsewhere, and he really enjoyed that. And we were able to get him on a plan that actually paid back and helped with the Part B premium as well. So, I mean, it just takes some exploring, but that's a great question. You can certainly use the VA exclusively and then forget about Medicare for the rest of your life if you wanted to. But it's worth exploring the benefit that you paid into if you ever have worked and paid your Medicare tax. So that's the best answer I got for that.
That's a great one. I love, there's always kind of different circumstances, and to look at it as an individual case. Thank you, Rob. I have a next question if you are ready for it.
Shoot.
It says, once you reach full Medicare retirement age, like the 66 and a half, can you still work and get full benefits, or do they deduct some of what you make?
Yeah, so that's a Social Security question. And it's not necessarily pertaining to Medicare, but basically, yes, they will, once you hit full retirement age on Social Security, and you're talking about the payments you're getting from Social Security, and you're still working, they will do some sort of prorating on that benefit because, that's just the program that they designed. So yes, and I won't be able to go in depth with what that entails today, but yes, if you are working and you're getting Social Security, you should expect some sort of deduction from that payment. So.
Perfect. I hope that helps. And if you guys have any questions after this, I did post some contact information that you can reach us if you do have questions after this. I love this next one, Rob, and I think you're going to enjoy it as well, because I know you are passionate about this. I have a country health plan that will continue in retirement. Medicare requires I enroll at an age of 65. My country insurance will then be secondary. Can I enroll in only Part A and thus meet the enrollment requirement and then allow the remaining insurance coverage to fall to my their country plan?
Yeah. So what's important is that you find out if your plan, so the country plan, I don't know if this is private insurance or if they're referring to a work plan.
It's a county health plan.
A county, okay. Yeah, so your county is providing credible coverage. And so the government considers that coverage. So you're fine. You don't have to do anything. So again, going back to that first point, you don't have to do anything if you don't want to. You could go ahead and explore Part A and having that as primary and secondary. And some employers, they want to get people off their work plan, so they will have different programs to some of them will allow you to have stay on their plan, some of them won't. So it's good to check with your employer to see what sort of program they have as far as transitioning to Medicare. But a lot of times they just allow you to stay on the plan because you're working for them. So to answer your question is there's no requirement for you to do anything if you were on what's called credible coverage and your county work plan is credible coverage. And so you can go ahead and enroll in A if you want. It's not going to cost you anything. You'll just be in the system. And then when you retire, you can go ahead and hop on Part B and find supplement plans for you.
That's great. I love it. I really know you're passionate about the requirements to enroll and whether or not it is required. So this one is kind of relating to that previous one, but they also said, this is my question. If you're taking Social Security at age 65, enrollment into Medicare is supposedly seamless. Apparently, that's not the case if you're still working. Do you have any advice on that?
So, I mean, you have to work with the government on this. So, and that's not always an easy task. So, when we enroll people when I help enroll people in Medicare, you can do it online. You need a Social Security account online. And then, they'll give you options on how to credit or how to pay for that premium for Part B. Okay. So if you are taking Medicare, you can certainly transition that over. It just takes some working with the Social Security office and the Medicare office to get that done. When you enroll in a Medicare Advantage plan, they will ask if you want that deducted from Social Security. So there are different triggers that will allow it to happen. You just kind of have to work through that process. And if you need specific help or specific questions about your situation, that's something I can help with as well.
Amazing. Thank you, Rob. That is all the questions I have coming in for now. So we'll continue because I definitely want to leave some time at the end for any questions and answers.
Perfect. So I'm almost done. I'm going to give you guys an example of some of the supplements. And so this is a good kind of run through on just what an Advantage plan is compared to a supplement plan. So let's review the supplement plan. Again, and this is the second payer system. So the Medicare is going to pay some of it. These guys are going to come in and fill the gap. And so if we look at Plan G, basically everything A and B related is going to be covered 100%, except for the Part B premium, which is what your responsibility will be. And so that's a good refresher there. Now let's go into a Advantage plan. So I removed kind of the company specific stuff here. So this is just a generic, you can't even get this schedule of plan in our area, but I just put an example of some advantage plans that I've worked with in a table that we can go over. So you'll see at the top, they have different plans. Some of them are HMOs. One of them is on the left, and then the rest of them are PPOs. So that's an important distinction when it comes to advantage plans is, are you on an HMO or are you on a PPO? And so the difference is the HMO is a closed network. You got to use all the doctors in that network, or else you're not getting coverage. So the only exception to that is emergencies. If you're out, Medicare as a whole, if you're out of your network, and let's just say you take a trip to the East Coast and you're from the West Coast, and you have an emergency, that will get covered. But everything else, you'll need to stay in network to get covered on an HMO. A PPO is an open network plan. So you have an in-network and an out-of-network schedule. And so the distinction of these plans is going to be in cost and benefits, because with a closed network, the plan administrators can keep the cost low. So they're able to negotiate with the doctors that in their network and keep it low and keep the benefits high for you. So help you out with better benefits. But the PPO plan allows you to go out of network if you want to. So it's my job as a Medicare professional agent working with people to identify who are they seeing, because if they're seeing everybody in the network already, you might be wanting an HMO to have some savings because you're already seeing those people in the network. Or if you kind of bounce around a little bit, you might want a PPO plan. And let me go back to the supplement plan, that the biggest advantage to these is that anybody in the nation who takes Medicare can take these plans. So you are a free agent. You have zero networks to navigate through. That makes it a lot easier to use and navigate. So that's one of the advantages to these supplement plans. But these advantage plans, you can see the plan premium is $0 on a lot of these. One of them has 39, and so they are less expensive. But in certain situations, they might be more. So you look at the annual maximum out of pocket, you can see that the HMO is $3,900, and then the rest of these are, around $6,000, and then $10,000 for out of network service. So it's quite possible to pay more if you have expensive events in your healthcare for a given year on these plans. And so if you're a high consumer of healthcare, you might want to consider these supplement plans because you're using it a lot, you have to navigate it a lot, and you may incur a lot of costs associated with that. Might as well have a supplement plan take care of those costs for you. But if you're the type of person that's a low consumer of healthcare, and you're okay with navigating a network, you're okay with kind of jumping over some hoops for that, they'll both get you the quality care you can get, but it's just a different way to receive that, and it may be a little bit easier on the supplement plan than the advantage plan. But you miss out on the extra benefits as well. So it's just kind of one of those things that for an individual, you have to decide what's important to you. And so here's an example of that. You have an out-of-pocket maximum. For the gentleman or lady who referred to VA benefits, the one on the right is an example of one that does not include Part D. And if you see this Part B premium reduction, they'll actually give you $100 to credit to your $170 Part B premium. And so on this plan, you don't get D coverage, which is used on the VA side anyway. You get your VA benefits anyway for prescription drugs, but they allow you to use their network and their resources and different hospitals. So it just opens up your care a little bit more. So pay attention to plans like that if you're a VA user. But everybody else, your decision on a Medicare Advantage, if you're going that route, is between an HMO and a PPO. And then you take a look at, excuse me, let me get my slides here. You take a look at the different copays associated. So you have specialist copays, you have emergency room copays. Let me go back up to this slide. The important one is the inpatient hospital. So remember, we had $1,500 that we needed the deductible that we needed to pay. On these Advantage plans, if you look at the HMO, it's around $300 per day for days 1 through 6. So that's like an $1,800 bill. So it is possible to pay more on some of these plans. But in general, they're going to be a lot better in the long run. So for example, you have from days 70 through 90, you have $0. And so these Advantage plans are required to give you the minimum that A and B coverage gives you anyway, but they just expand on them because they can use that money more efficiently than let's say the government. Good. So you can see there's copays associated with these Advantage plans, whereas the supplement may not. You have, I'll refer down to the dental, vision, and hearing. That's and it says non-Medicare coverage. So this is stuff that they just throw in that Medicare doesn't even offer. And right there is the dental. They'll give you $1,000 to pay on your dental services for the year. There's eye exams. There's eyewear credits. There's hearing aid credits. So you can get $5,000 hearing aids for a discount. Those are expensive. And so I won't go into huge details on this. There's fitness programs. You get free gym memberships. There's over-the-counter credits. So you go to CVS and you can stock up every quarter with $45. Stock up your pantry, things like that. So that's kind of like what these plans do, is they give you the A and B coverage, and then they throw in extra benefits to kind of sweeten the deal a little bit. And typically it's a really good alternative to just having A and B. And so you want to consider that definitely. And so down here is the prescription drug table. So the Advantage plans will throw in prescription drug coverage, which is nice. So you satisfy that drug coverage for Part D on one of these plans. You don't have to go out and buy a separate one. And that's that. So I have a few minutes, and I want to let you guys know about election periods. So every year, when you're on an Advantage plan or a Part D plan, you have an opportunity every year between October 15th and December 7th to change plans. This is called annual election period. So that's the great thing about Medicare, is you can change plans. You don't have to go through underwriting or anything, or they don't care if you're healthy or not. You can change plans. So if you're on a certain plan in your area, you decide you want to go in a different direction, you can call up an agent like me and explore other options. Then there's open election period, which is going on right now, and you can change between Medicare Advantage plans as well, or just get off the Medicare Advantage and get on original Medicare as well. Then there's special election period. So this will apply to you guys who want to stay on your employer plan and then get off and get on Medicare. You will do what's called an SEP, special election period, loss of employer coverage, and you'll be able to get on a plan, and a window will be open for you. If you change residence, so you go from Washoe County to maybe you move to Elko, for example, you have a special election period. You can hop off your plan here and get a new plan over there. Also, low income subsidy. So if you are in a low income bracket, you have more flexibility to change your plans. because there are specific plans for those types of people, and I'd love to, if you're in that situation where you may be Medicaid eligible or that sort of low income subsidy situation. Yeah, we'd love to explore how we can maximize those benefits, those extra benefits from the government. And then there's initial election period, which is when you turn 65, you have 3 months prior to your birthday month and 3 months after your birthday month to apply for Medicare. So you have a 7-month window there. So these are important election periods to remember. But guys like me who are kind of in this world have these kind of burned into our brains. So it's good. It's good also to get advice from an agent as well on these election periods. So when you're on an Advantage plan, there are those copays that you still have to provide. There are other high-cost situations like the skilled nursing care, and those out-of-pocket maximums can get pricey. $3,900 for the HMO in our example, or $5,500, for example, for a PPO. If you want to get some of that covered, then there are additional add-ons that you can put on plans that you can get from separate insurance companies. Cancer, heart attack, stroke plans are also available. Those will give you lump sum payments for an event like that. If you have history of that in your family, you may want to explore that because it's nice to get financial assistance in those events help a ton. And so whether you're working or not or whatever, it's really good to make sure that you have that event. You're probably going to incur costs on these Advantage plans, and you have some money set aside in an insurance policy to cover that stuff. So there are extras that we can talk about, and stay tuned for more information on stuff like this. I think I might want to build out a presentation on this as well. So we'd love to keep in touch with you if you're interested in getting more in depth into that. So that's all I have. And yeah, let me just stop presentation here. So that's all I have.
I was just going to ask, Rob, it would be great to see your face while we answer some questions.
Yeah, so let's answer some questions. That's a lot of information. So I hope that any questions that we don't answer, I just hope that you can at least get a phone call with me or get on my calendar if you need to, or I'm willing to help in any way I can. So let's do some Q&A right now.
Awesome. I appreciate that. We did have quite a few come in, and I'm away from Medicare, but man, I'm learning so much. This is great information. So thank you for being here. First question is, when do you enroll for coverage? When should I enroll for coverage?
You should enroll in coverage.
At what age?
When you're 65, you'll be eligible for coverage. So you have the option to do that. If you're on a work plan, you do not have to enroll. So typically, I meet with people who are turning 65 and want to get on Medicare. And I also meet with people who are retiring and want to get, they're losing their coverage with their work and they need to get on Medicare. So that is kind of the gist of that. 65 is when you're eligible. That's when you should explore this stuff, definitely. And to be more specific, you have 3 months prior to enroll. So you may want to talk to somebody like me, maybe 4 months prior or 6 months prior, and kind of get a game plan going, because you still have to enroll in Medicare. That's with the Social Security Department and not with me. So that is kind of its own game in itself. They're not so prompt in a lot of their enrollments. And so somebody like me can help navigate you through that. And that's kind of a lot of people find that daunting in itself, is actually working with the government to enroll in this stuff. And it's as easy as getting online and knowing where to go and getting an account and clicking a few buttons. So It shouldn't be daunting if you know what you're doing, but that's a service that we can provide as well.
Perfect. Yes, I love, Rob, we had chatted yesterday of, yeah, you actually sit down and can walk us through that. So, all right, the next one is less of a question, but I think it's a great point to bring up, and just wanted to see if you wanted to add to it. But they shared that their primary care mentioned that she only will accept certain Medicare plans. So they have to check with their primary care to ensure which Medicare plan they're still using.
Yeah. So good. So the answer to that question is it depends on the plan. So how Medicare is set up, if you have that supplement plan, if you do the original Medicare plan with the supplement and the a la carte option, anybody who takes Medicare, who gets billed for Medicare, and there's some doctors that don't take Medicare, they just don't want the hassle of doing insurance through Medicare. They're rare, and if you're in an industry where you're working with people over 65, you won't get much business if you don't. But basically, if you're on that supplement plan, anybody who takes Medicare will take it. They're referring to an Advantage plan. So if you're on an Advantage plan, yes, you'll need to figure out if your doctors take that. So what I do with people in my office is just go through kind of a matrix of who are your providers that you want to see, what are the prescription drugs that you are taking, and then I have the tools that will be able to identify the plans in the area that actually like take those plans. So yes, you can refer to them. In my experience, calling providers for information on what plans they take is not the easiest route to go. It's easier to go through somebody like me who actually understands the networks and understands the plan, the connection between Medicare specifically and their business, because they take so many different insurances that a lot of them just are overwhelmed with that information anyway. So so there's that.
Awesome. Thank you. Yeah, I figured it was a great point to bring up. We have a couple more and we're approaching time here, but this one I love. Do I have to go on Medicare at 65 if I'm working and have medical insurance?
No, you don't.
Oh,
Yeah, surprise, surprise. So again, just to reiterate, if you are working, the big misconception is that you have to do something. You don't have to do anything. You can do nothing. You'll be okay. What I will say, and just to get more in depth with this, when you retire and come see somebody like me, I will give you a form that will prove you've had credible coverage. That's important to get. So when you retire and you're beyond 65, let's just say you take a couple years and beyond 65 and then you retire and then you want to get on Medicare, you need a form that says, I've had this credible coverage, and it's signed by your HR person, and then you can turn it in and you're fine. You won't be penalized. It will be as if you signed up originally at 65.
perfect. Thank you so much. This next one, they just asked for your contact information, so I wanted to put a note that I did post Rob's contact information, but also on this call is our financial services coordinator, Susan. She is happy to help you guys set an appointment, get in contact with Rob, and we also do have other financial services available that Rob can help with. It's not just Medicare, so please do feel free to reach out. The next one, do you recommend, and we have two more, and we're approaching about 5 minutes left, but do you recommend MA plans?
So I kind of did a description earlier. I don't know if this person was on here, but the description that I gave you is a good one. Like, if you're a low consumer of healthcare and you're okay with navigating through networks, or you like the low cost, upfront cost aspect of it, Medicare Advantage might be for you. If you don't want to don't want to deal with networks, or maybe you're traveling all the time and you're seeing people in different places, or seeing doctors not just here, but maybe you have a favorite doctor in California or something, the supplement plan is better. It's going to cost a little bit more upfront, but that might be a better option for you. So it totally depends on your needs, and so and your consumption of healthcare. And so I can like give you a better idea about that. And so some people ask me, like, what do I prefer? It's like I would prefer what's best for me. If I want to spend the money, then yeah, I would do the supplement route and go that route. But if I want to save money, yeah, the Medicare Advantage plan might be for me. So it just depends, and that's all I'll say about that.
Perfect. Thank you. I think that was a great answer. This is the last one we have coming through, but is it easier to just get a Part A and then once you retire, then go to a Part B?
Either way, you can't get, okay, so they just changed this. So it used to be that they would just enroll you in Part A automatically. They stopped doing that because I don't know why, but they just stopped doing that. So you don't have to do anything, and then you won't be on the Medicare program at all. But like I said before, you can enroll in A and just have that coverage without B. And yes, you can do that. But I only recommend that if you're on a work plan. That's going to cover the bulk of what your medical is going to do, and then you have that A coverage if you want to use it. And so it gets complicated when you try to blend insurances. It just does. And people that do that rely on two, like the Medicare A and then their work plan, end up only using one anyway. So it's my experience that I just recommend people kind of go all in on one or the other, and try to do that, because chances are you're going to that's what you're going to do anyway. So.
Perfect. Thank you, Rob. I think those are great answers. And that concludes all of our questions for today. But I did want to point out, please, again, you guys have our contact information. We are happy to help as questions come after, as they so often do. And I just wanted to pass it off to Michelle, and she will finish us off.
Thank you, Saray. Thank you, Rob, and to those attending the Greater Nevada Financial Wellness Series. For those that would like more information from Rob, we will be sending out a follow-up email with a survey and Rob's contact information. If you're interested in learning more about these webinars, please check out our website at gncu.org and search for Greater Financial Wellness Hub. And thank you again, and make a great day.
Thanks, guys.
Thank you. Thank you so much. See you guys on the next one.